Say act on Mouth Health this World Oral Health Day by learning about good oral care, spreading the word, and participating in an event. Take care of your oral health to protect your mouth and body.
Good morning, everyone. Welcome to Sujay's Dental Care's Oral Health Talk. As you all know, we had celebrated World Oral Health Day, and we had promised that we will create awareness in the population by conducting Oral Health Talk every month. And today, I'm again welcoming you all for the April's edition of Oral World Health Day, and it is called as April's edition of Oral Health Talk. And today's topic will be we have chosen diabetes mellitus and its implications on oral health. And why did we choose this topic is because diabetes mellitus is the most prevalent disease amongst Indians, and diabetes mellitus is in the year when the survey has been conducted in the year 2000. India had topped the world in its prevalence, and followed by China and United States. According to Wild et al., by the year 2030, world's diabetic mellitus patients is going to be doubled by the year 2030. So that is why, and in our clinic, most of the patients, say about 21% of patients who are aged 60 years or older are coming with diabetes mellitus. So we want to help or create awareness amongst these patients and help them resolve all their doubts before they should come without any anxiety, with a lot of questions in their mind. So we have probably tried to reduce their doubts and talk about diabetes mellitus and its oral implications. Okay. So I would want you to talk about diabetes mellitus, and to start with, we will go with the definition.
So as we commonly know, diabetes mellitus is increased blood sugar levels in our body. But if we had to actually define it, how do we define it? So diabetes is a chronic disease that is caused by inherited and or acquired deficiency in the production of insulin by the pancreas, or by ineffectiveness of the insulin produced.
Okay. So what are the common symptoms and signs that patients are experiencing in diabetes mellitus?
So the most common signs and symptoms that we can see with patients with diabetes are: number one is polyuria, that is excessive urination; polydipsia, that is excessive thirst; and polyphagia, that is excessive hunger. Then we can see tiredness in those patients. Then abnormal weight loss is seen. Fatigue is seen. Then delayed wound healing is seen. Blurred vision is seen. And neuropathy is seen for these patients. Yes.
And
renal failure are seen.
So followed by the most common signs and symptoms. We will talk about these commonly or most common classification, most recent classification of diabetes mellitus is type 1, type 2 and gestational diabetes. So can you elaborate about type 1, type 2?
Surely. Type 1 diabetes is usually insulin dependent diabetes, in which insulin is not getting produced from the pancreas. It is usually seen in children. Now type 2 diabetes, which is usually seen in adults. So this, that is body's inability to respond properly to the action of insulin. And then there is gestational diabetes, which is usually seen in pregnant ladies. It is usually seen in 2 to 5% of pregnancies.
Next heading will be idiopathogenesis, or how does diabetes occurs in the body. So everybody knows that each and every cell in our body requires insulin for glucose uptake. To produce energies in particular cells. So, can you elaborate on etiopathogenesis of?
Sure, sir. So when we usually consume food, that is carbohydrates, they will get metabolized, that is they will break down into simpler form of sugars, that is called glucose. Now this glucose will be taken up by each and every cell in the body to give energy. So for this process to happen, for the glucose intake to the cell, insulin is needed. Insulin plays an important key in this process. So when the insulin goes to the cell and it attaches itself to the cell to the insulin receptor, the cell take up the glucose from the blood and thus helping to produce energy.
So to make it very simpler to our audience, so there is insulin pure and there is a cell membrane. This is a cell, and top of it, this is called a cell membrane, right? So there are receptors on the cell membrane to receive insulin, and then which will actually facilitate the insulin intake, but glucose goes into the cell if the receptor accepts insulin. So if insulin is not produced.
Now, as we know in type 1 diabetes, as we have actually discussed, insulin is not getting produced. So when insulin is not getting produced from the pancreas, the insulin cannot go and attach itself to the receptor cells that is present on the cell membrane. Thus the glucose is not getting uptake by the cell. Thus the glucose is there in the blood, causing high blood sugar levels. Now in type 2 diabetes, in which insulin is actually getting produced, but it is the receptor cells which are not accepting insulin. Its inability to accept insulin.
The insulin receptors are
not getting
or modified, or
yes.
There is a pathogen.
Pathogenesis present, so it's not taking up insulin, for which again the cell is not able to take up the glucose present in the blood, thus causing high blood sugar levels.
This is all about etiopathogenesis. This is how glucose will remain in the blood, causing increase in excessive glucose levels in the blood. So this is also called as diabetes mellitus. So why are people with diabetes mellitus more prone to rectal infections? Or in a certain way, what we can put it is, how these diabetes mellitus affects oral tissues.
Now the patients which are suffering from diabetes are more prone to infections and vascular complications. In these patients, even the healing process is impaired. Now this is actually happening because of three main things, which is there is an increase in anaerobic bacteria. Anaerobic bacteria are bacteria which can survive without oxygen. So the next point is there is an alteration in the neutrophils. Now neutrophils, as we know, is the first line of defense in our body. And the third point is altered collagen metabolism, which actually helps in healing and bone formation.
So if you have to elaborate this about neutrophils being the first line of defense mechanism, neutrophils are affected by how does inability of the neutrophils affect? Usually the chemotaxis, phagocytosis, and other adherence
to the
factors are impaired. So that is how the neutrophils are not working in the diabetes mellitus patients. So next question will be, what are the signs and symptoms which are oral signs and symptoms present in diabetes mellitus? So as I want to say to our viewers that as face is the index of our mind, in dentistry what we call is mouth is the index of so many underlying unknown diseases. So when you when any dentist checks your oral tissues, not only he will look into the teeth, he will also look into the soft tissues also, which can actually identify a lot of underlying diseases, not only diabetes, there are a lot of unknown underlying systemic diseases basically. So to stick to the relevant topic today, what are the signs and symptoms which you find in the oral cavity, whom you can actually tell that these patients are diabetic patients?
So in patients with diabetes mellitus, we can usually see the oral signs and symptoms that are very commonly seen. That is redness of the gums, swelling of the gums, and there is bleeding of the gums. Then bone loss is seen in these patients. Then candidiasis, which is a kind of fungal infection which is usually seen in these patients. Then there is excessive bone loss. Then in these patients, the burning sensation is there in the mouth, which is called burning mouth syndrome, xerostomia. Then burning of the tongue, fissured tongue or geographic tongue, which we say, that is also usually seen in these patients. Increased dental caries because of xerostomia, and multiple gum infections are seen in these patients.
And what about these lichenoid?
Yes, lichenoid,
lichen
planus, all kind of infections. Basically, yes, seen in this.
Okay. So to further add to one more question, so if a patient has to do a self-examination, what he'll have to check for, or what are the basic signs and symptoms which draws patient's attention to dentist, or what would a patient see for themselves, or when do they seek your seek dentists to treat dental infections and other symptoms?
So in patients, normally patients who have diabetes, they will see bleeding of gums, and they will see burning mouth syndrome, xerostomia will be present in them. Then lot of gum infections will be present in them, which will actually draw them to go for a dental checkup done. Usually otherwise they won't come, but if they see a lot of gum infections is happening on a progressive rate, so they will.
What age group are we looking at? So those who are aged about 35 years or 40 years, if they find out any of these signs and symptoms,
they should definitely
immediately
come for a dental visit and get their dental checkup done.
Okay.
So the most commonly asked questions by all the diabetes patients is that, can we undergo any dental treatment? So what would you like to say about that?
Any diabetic patients are fit to undergo any kind of dental procedures, starting from scaling till major surgery. So since as the patient approaches our dental clinic, we follow certain protocols. We will start with we will take the medical history basically. Once medical history is evaluated, we will categorize patients into different categories, which is mild, moderate, and severe risk categories. And since with the blood investigations, we will put patients into each and every categories. And then we will follow a protocol with stress reduction protocol, which includes early morning appointments and what else? Early morning appointments. Sedation can be taken. Adequate breakfast needs to be, and treatment breaks. And these are certain stress reduction. Usually, most common complications that you see in diabetes mellitus is hypoglycemia. Hypoglycemia is nothing but lowering of your blood sugar level, which causes dizziness, and probably as a consequence, it might lead to some syncope and stuff like that. So it can be treated. Hypoglycemia can be treated in a dental setup itself. So usually immediately glucose will be given so that their sugar levels becomes normal, and their the alertness or drowsiness Majorly, apart from that, we will explain about how do we treat mild, moderate, and severe risk category patients. So one by one, as you know, what precautions do we take care in mild category? Can you explain or put some light on it? To further add to our question, so in our dental care, as everybody knows, we are the NABH accredited dental care. What protocols and guidelines that we will follow in our dental clinic, where diabetes mellitus patients can undergo all the treatments. So since I have already told, dental diabetes mellitus patients can undergo every procedure from the basic scaling to surgical procedures. So how do we categorize and what protocols do we follow now?
So in our dental clinic, we usually classify the diabetic patients into 3 categories. Number 1 is mild category, number 2 is moderate category, and number 3 is severe risk patients category.
Okay.
So in mild category patients, the HbA1c is less than equal to 7 with mean blood sugar level as less than equal to 150 mg/dl. For moderate risk patients, the HbA1c is 7 to 10 while the mean blood sugar level is 150 to 240 mg/dl. Now for high risk patients, the HbA1c levels are greater than 10 while the mean blood sugar levels is 240 and above. Now, if we had to classify mild patients category, in these patients, they need very little care and attention and can be treated with normal protocols because they are the low risk patients.
Okay. So in mild category patients, we can treat them as any other normal healthy patients. So when we come to moderate risk category patients, what are we looking at? So we will further classify this into surgical and non-surgical procedures. So what precautions, protocols do you follow in surgical? First we will start with non-surgical and then followed by surgical procedures.
Now for moderate risk patients, for getting a non-surgical procedure done, these procedures can be followed as mild risk patients only. For getting a surgical procedure done, oral sedation will be considered with an antibiotic coverage, and if required, medical consultation will precede moderate or advanced surgical procedures.
Okay. So probably we can, for the surgical procedures, we can take the consultations from medical
physician.
So how do we treat high-risk category patients? First we will talk about non-surgical and then the surgical procedures.
Now for high-risk patients who have uncontrolled diabetes, because as I already said, their HbA1c is greater than 10 and their mean blood sugar levels is greater than 240 mg/dl. All procedures such as non-surgical and surgical procedures will require medical consultation. And if it is non-emergency treatment, it is said that it will be deferred until medical condition is stabilized for such patients.
So we will take a consultation from the dietitian and we will get them if it is an emergency.
Situation.
Then we'll have to do certain protocols to immediately reduce the infection. Start with an antibiotic therapy and then suggest or refer them to the dietitian. And if it is non-emergency, if it can wait, we will wait for the entire
blood sugar levels to get control so that he or she can undergo immediate treatment.
So you mean to say diabetic mellitus patients can undergo each and every treatment, provided the blood sugar levels are under control. Okay. So I think this concludes our topic of the day, and we will take certain questions which we have got it through emails, and I will pick a couple of questions and I'll ask you. We will try to answer as many questions as possible, and hopefully this will
help all our patients.
reduce the doubts of the patients.